Welcome to the episode 8 of Ask Giri, the Physio Show. Your host, Giri Srinivasan, registered physical therapist. Today, our topic is breast cancer physiotherapy. We all know someone who has breast cancer or who had an operation for breast cancer. So we also seeing quite a bit of patients in the clinic during breast cancer, especially after the surgeries. There are so many complications can happen, so many things can go on biopsychosocially and also physically, which needs help. And physiotherapist's role is very immense, is one of the important team member in the breast cancer physiotherapy rehabilitation actually. Your team members includes yourself, your oncologist, your radiation oncology, your chemotherapy, your nurses and social workers, so many people involved in the team, and physiotherapist, it plays a very important role in that. We're going to discuss some evidence-based practice methods and some tips for you to help you with your recovery from the breast cancer, whether you had surgery or not. So the management of breast cancer is like in a constant evolution. It's just keep changing the protocols, the methods we use, the things we do, so much research and innovation, and we're getting better and better. Since the survival rate is much higher now, we're going to see it in the next slide. It has increased almost 14% now compared to what it was before. People are living longer, and then the fear is going down. They know that once a proper surgery is done and once a proper rehab is done, you can get back to near normal lifestyle, and that is possible. So the survival rates. So 1 in 9 women in Canada, they say, will have breast cancer. That's a big number. And if you see that survival rate is improved from 73% to 87% compared to 1980 to today. So that's a good increase. That's a good news about the survival rate. But the not so good news is, like, they're expecting from 2015 to 30, in the 15 years, they expect the breast cancer numbers to go up by 25%. That's mainly due to the aging population we have in Canada. That's why. So the next one, what are the reasons? Why do you need to do exercises? So you must be thinking, I just came across a big cancer or a tumor, I had a big surgery, life-threatening, and you're asking me to do exercises? Yes, it really helps. And I'm sure we have a great healthcare system, and professionals and physicians and surgeons in our community will provide you a lot of information about how to take care of yourself and what kind of exercises you should be doing. And we should follow that. And what are the main reasons why we should do the exercises after breast cancer, during or after breast cancer? And also sometimes you can do prehab too. That means before the surgery, you know you're going to have a surgery down the road, then you can prepare yourself mentally and physically by doing some exercises for your body. So number one reason for exercise is to combat the side effects of your breast cancer treatments. Right? There are so many side effects, the fluid retention, weight gain, so many fatigue, so many things can happen where exercises can come into role to help you with that. And to improve muscle mass, right? Radiation therapy and muscles, they don't go very well together. And so you lose muscle mass, and also you decondition because of your pain, and because of the situation, you're not able to move very well, you lose your muscle mass. So exercises can help you to build that muscle mass. And to improve bone health as well. Bone health is affected because of the multifactorial thing. Number one, most of the people getting breast cancer is a post-menopausal age. So already there is a estrogen deficiency, which is really not helping your bone health. And number two, when you have chemotherapy, especially when you have the hormone blocking agents or medications going on, that will block your estrogen. And estrogen is very important for your bone health. And so the bone health can be affected that way too. So these are some of the reasons why you can have your bone health being affected, which is very important to do exercises to work on your bone health. Mental health, you all know how we can be so much depressed and anxious about the condition we got diagnosed with, and the family members, the social life, how it's getting affected, the cosmetic changes. There's so many things goes on in our mind. When I talk to patients, I understand that having a breast cancer. So having a good exercise also increases your endorphins, your happy hormones in your brain, which will help you in your mental health. And also having a good social life with your, have fun with your friends and family and the laugh, that really helps with your mental health as well. and to reduce the lymphedema. Lymphedema is the swelling which comes because of the changes and trauma happens to the lymphatic system in your body. We're going to talk a little bit detail about that later, and it can create a lot of swelling and other complications, especially in the upper limb and the trunk and the face sometimes, which exercises can help along with your other modalities of treatment. Then there are some evidence also that doing regular exercises after your breast cancer can also reduce the risk of recurrence, and that's the good news also. So these are some of the reasons why we should do exercises prehab or during or after your breast cancer. So what are the things you should be doing? So I'm not going into the detail of different types of breast cancer, different types of surgeries and malignancies and everything. We're going straight into the topic where what can you do yourself, by yourself, to help yourself. Directly going into starting with breathing. Very, very important thing. It starts on the first day after your surgery, even in the hospital. Your diaphragmatic breathing exercises, because your diaphragm is right here, a big dome. See the approximation of that big structure to your breast. So anytime when you have a major problems going on here, the pain can inhibit the diaphragmatic function, right? So that's why to have a very good diaphragmatic breathing is very important. You have to consult your community physiotherapist if you don't know how to do it properly. To engage in this activity is really, really helpful. Okay, just very simple, having one hand on your chest and one hand on your diaphragm. Okay, taking your breath into your nose and out through your mouth. So make sure that top hand on your chest doesn't move at all, and that only the bottom hand, which is on top of your abdomen, moves out and in as you inspire and expire. And there is different modifications of this exercises. You can have 4 seconds inspiration and 8 seconds hold and about 7 seconds expiration. That's one way of doing it. And also for they call it lymphatic breathing. When you have lymphatic issues, your hold time can be increased. You can have like about 4 to 6 seconds inspiration, hold it for about 16 seconds, and then leave it out for about 8 to 10 seconds. So there are different formats. You can play with that inspiration, hold time and expiration. So that's why you need to consult a registered physical therapist to help you with what kind of breathing pattern is good for you. If you want to just by yourself, just a very simple inspiration, about 4 or 5 seconds, and expiration about 8 seconds, and nicely keeping the chest wall really quiet, and also your accessory muscles in the neck really quiet, not raising the shoulders or anything like that. Very, very important exercise there. That big dome really needs to expand. It's not only after breast cancer. We go through so many people every day. I correct breathing patterns with normal people with no surgeries, no breast cancer, just sit and work, and they don't even know when the breathing pattern has changed. They become abnormal breathers, so dysfunctional breathing. And this is a very important thing. You check with your family members too. How many people, when you ask them to take a deep breath, the chest is moving too much. So that's not the right way to breathe. Then, segmental breathing. So what happens when you have a surgery or the breast cancer, especially the middle and lower lobe area here, the segments here, expansion will be very reduced in the lung expansion and also the chest expansion. That's why the segmental breathing exercises are very helpful. You can keep your hands alongside the ribs and then take your breath in, and the hand goes out, and then take your breath out, the hand comes in. You can also have a gentle pressure along the ribs to help you, to give you that feedback, give your brain that feedback about the expansion and things. This is exercise we are teaching now more. Even we see a lot of post-COVID patients now. We are teaching this diaphragmatic and segmental breathing quite a bit. You can also put a towel around your kind of under the breast and hold it like this, and you can use the towel as a proprioceptive feedback instead of using your hands too. So that's other ways to do it too. You can do all these exercises in lying, in sitting, in standing. It's very important. Whatever the position is comfortable for you, you can use that position for your breathing exercises. Then I'm sure everybody who went through breast cancer or the surgery will know a little bit about the lymphatic system. For the people who are new to this, you need to know about your lymphatic system to understand what is going on. And I put a small picture there. It's a big system. It takes care of a lot of things in your body. And also the picture there about the lymphatic system around the breast, you can see the two important nodes there are the supraclavicular nodes, which is on top of this clavicle bone right here, collarbone. And then other one is the axillary lymph nodes. So during some of the surgeries, they can remove a whole bunch of axillary nodes, and also they might remove one or two nodules we call sentinel nodes removal surgery. So depends on what your surgeon decides, and how much nodes has to be removed, what is the count, everything. It matters because your axial dissection, it's a big surgery. They remove a lot of nodes from there, and the recovery can be a little bit delayed compared to removing one or two nodes. So you need to know about the axillary nodes and the supraclavicular nodes. Lymphatic system, if you see in the slides there, it helps so much about immune systems, right? So it kind of produces cells that fights disease, your T cells, B cells, a lot of cells are produced in the system which fights the disease. Immunity is a big thing now, even in that COVID situation. We all need to have a very good immunity to protect ourselves. And also, there is a lot of evidence showing that exercise helps the lymphatic system function, how it functions. Because the next slide you see how the exercise contracts the muscle and how the muscle contraction helps in the movement of the fluid in the lymphatic system. Right? If you see a picture of anatomical picture, you see a lot of nerves, you see a lot of blood vessels, veins and arteries, and also you will see a lot of lymphatic vessels. They spread like so much network in your body, lymphatic vessels. So they kind of communicate with the duct and your other organs, and also your thymus and spleen, and also they work and taking care of all these immunity functions and taking care of all the cells and the transport of important function. That's very important. So after the surgery, what are the things you can do to help yourself? Obviously, you're going to go with your physiotherapist to learn some of these techniques, but I'm just helping you to kind of educate you about what are things you can do. This is not a replacement for your medical advice from your registered physical therapist in your community, so you can learn it better firsthand. So gliding strokes with skin movement is very important. Usually we'll starting with, for example, if your left breast is affected, so we go 10 reps. We do not go towards the affected side. Always you stroke away from the side. For example, you go like this, right? You go like this, strokes away from this axillary nodes. Always you don't go towards the affected side because you compromise the nodes and the lymphatic system in that side. So nice little strokes, gliding strokes. Let me show with you my right hand, it's easy. Imagine the right breast is affected. You go nice gliding strokes away from it towards the sternum or your chest bone, right? About 10 reps coming from here, from this part of here, and then come all the way here. Gliding strokes you can do above, and then you can go below the breast like this, right, away from it, just to get that tissue moving very well, because a lot of things happening to the tissue, breast tissue, and also the pectoral tissue and the pectoral fascia, which is underneath the breast. So it's nice to give the gliding strokes along with the skin, nice and smooth and gentle, and you have to incorporate that from nice inspiration, expiration, breathing, and without using the chest muscles too much. Up and down you can do. Always remember, you have to push the fluid away from the affected axilla or the armpit. So this can be done in lying position or sitting position or even standing position, whatever position you can do. Then another kind of strokes you can do is from the affected breast to the inguinal nodes. So for example, if this side is affected, there's too many gadgets on me to do a smooth movement, but you kind of go from here, you go all the way down to your inguinal nodes, which is in your groin area. So you're taking it all the way from here, all the way going down into your groin, and then just taking it there. So that's another nodes, because you're trying to get those things into moving into the nodes. So the top ones can go to the clavicular nodes, and the bottom one can goes to the inguinal nodes. It's kind of a very nice smooth gliding movements of the skin with breathing will be really helpful in that management. And also, I guess if you go see a physiotherapist, they can perform this fantastic soft tissue manipulation and manual therapy and myofascial release for you. Shoulder movements, very important. There is lots of exercises. We take them stage by stage after the breast cancer surgery. What do you do in the week 1? What do you do week 2, week 3, week 4? Here I'm just generalizing some of the things. What are the things you can do for your shoulder? Mobility is very important. Strength, function, and range of motion are the 3 main things we look at when it comes to shoulder. We can do a lot of techniques, mobility exercises with the shoulder. Post isometric relaxation is very important. For example, if you only can lift your shoulder up to here, what we'll do, lift it here, and the therapist will offer some resistance for you, and then you try to push up, push, and then let it go. So what happens when you contract and relax, you relax some of the muscles in that other opposite side, so it will help you to improve the range a little bit. So physiotherapist will work with you, or you can also do self post isometric relaxation in different range. Wherever range you can go, you can stop there and resist, try to push and relax. Then maybe take it a little bit higher, resist, push and relax. Little bit higher, resist, push and relax. You can work with it with a good breathing. It's better to count loud, because a lot of people, when you do the post isometric relaxation exercise, they hold their breath. That's a very common thing. So you count loud, breathe nicely, and you can work on this very well. And also a lot of trunk side flexion exercises, because some of this pectoral fascia also connects to the lot of connection between the serratus anterior, your latissimus dorsi muscle, and in the front you kind of go into the fascia, and the rectus abdominis fascia continues here. So a lot of trunk exercises is important, like very simple one. If you can go up there, you can work on the trunk side flexion on both sides exercises. It's very important. If you can't get the arm up there, you can also do this way, right? So there's a lot of different ways you can do the trunk side flexion exercises. And very important is thoracic rotation exercises, incorporating with inspiration and expiration. Thoracic rotation, again, you can do that in multiple ways, in sitting, in your all fours, hands and knees, in standing, in bending forward, and so many. You can use a small dowel or a pole or a broomstick. You can use so many things to use thoracic rotation exercises, which is very important for you. It also enhances breathing, and also for the facial and the trunk mobility. And nerve gliding exercises. Sometimes you can have, we're going to talk about nerve a little bit later, but for example, a simple nerve gliding exercise, because your lymphatic things coming out of your, after here, the vessels, they kind of follow almost the median nerve kind of anatomy, the route all the way to the fingers. Because a lot of people, when we talk about cotting, will have a lot of pain in the axilla and also in the forearm, this area, and the thumb area. It's almost like the median nerve distribution. So when the nerve gliding exercises also helps the nerve and also the lymphatic system also. So you can start with your flexion, you can start from here, you can go there and do this and then come back. You can do 3 to 4 repetitions like that, right? And you can come back, that's in flexion. Then in abduction, you can do the same thing. You can go like this, right? And then come back. I got some tight wrist there, I can feel it in my forearm. Go like this. Okay, those are the nerve gliding exercises which are helpful for nerves and also for your lymphatic system. This is just some sample. There is extensive amount of exercises. I'm just giving you an idea, opening your gates for what are the possibilities, things we have to do. Oops. And then pelvic floor exercises. Why pelvic floor exercises? Because most of the breast cancer patients are in an age group where they do have some pelvic floor issues as well, right? And incontinence, it can be weak pelvic floor, it can be prolapse, it can be just deconditioning. So pelvic floor exercise is also helpful, because this dome right here, your diaphragm, your abdomen, your pelvic floor is very important to strengthen. And also some of the surgeries, the flap surgeries we talk about later, they take the flap from the lower abdomen. From hip to hip, they have to put an incision, whether it's a muscle flap or just the blood vessel fat flap, whatever they're taking, it affects the pelvic floor area too, because your barrel right here, the pressure barrel, is altered by those surgeries. So that's why pelvic floor exercise is very important. And we being pelvic floor physiotherapy clinic, we kind of easy for us to deal with this, because we have a knowledge about pelvic floor and also the breast cancer. We have done certifications in cancer rehabilitation as well. So we can put our knowledge into use to help our patients as well. And definitely consult your physiotherapist for this help as well. There's a lot of good pelvic floor physiotherapists in the city, so they can really help you with this as well. It's all comes in hand, hand in hand kind of in your rehabilitation. So squats and lunges and all fours exercises and bridging and all those things depends on the assessment, right? They have to do a pelvic floor assessment, then they determine what platform or how to progress you, where to start with your exercises, given your breast cancer on top of it, whether it's a conservative management or chemotherapy is going on or radiation going on, or after surgery, it means what kind of surgery, axillary node or sentinel node, or flaps, which kind of flap. It's a lot of factors into it, and every breast cancer patient is different with how they present to us. Moving on, spinal extension exercises. It's very important to improve your bone health, because as we talked about estrogen and the bone, estrogen helps bone a lot, and when estrogen goes down, bone health goes down. So to improve the bone health, you need to do extension exercises, put some load onto the bones to create good bone health. So spinal extension exercises, starting simply like the first image of just a Sphinx position, to kind of extending and alternate movements and just going up and holding there. This is a good test we do with the to check the spinal endurance also, extension endurance. So the third one with the green top, when that position, how long she can hold it there. That timing is important. You check yourself if you can. How long can you hold it in that position? And we want people to hold it 2 to 3 minutes on those positions. If you're below that, and it depends on your age group, consult with your physiotherapist. They can help you to improve that spinal extension endurance for you. Managing axillary dissection issues. So I told you that creates more issues because they remove more nodes from the axilla compared to the sentinel approach. So one of the most common complication we see in the clinic is post-operative coding, right? Cotting. The cotting is happening because of the lymphatic system. So the lymphatic vessels come all over your arm, and sometimes the lymphatic vessels attach to your skin with the small dendrites, kind of projections, right? That's how it's kind of anchored to your skin. So when cotting happens, it gets fibrosed and then that sticks out. The lymphatic vessel sticks out. It kind of pulls the dendrites and sticks out. That's what's called cotting. Okay, it's a sclerosis actually. And how to manage that? And the nerve injuries, there is your long thoracic nerve and the thoracodorsal nerve can get injured because of the proximity to the breast, and muscle imbalance and postural changes. It can happen from the nerve injury. It can also come without nerve injury just by the way patients are carrying themselves, right? And also long-term compensatory changes. It can be after 2 years after the breast cancer. You know, there are some habitual postural changes can happen, and long-term compensatory changes can happen, which can be really helped with working with the physiotherapist in your community. So cotting and manual therapy. So you see in the first picture, you can see the pull in your axillary region and also in the cubital area. Those are called cottings, and it's very easily to identify. And also sometimes you can get trunk and abdominal cotting as well. You can see in the second picture there. And in the third picture, I kind of put the lines, the red lines are your kind of a lymphatic system, the vessels, and the black ones in which direction you're going to do that skin work on it, right? When you do the cotting work, it's mostly skin work. We don't do a lot of transverse frictions like this on the cotting area. It's not very effective according to the research and evidence. Then a lot of skin work, very gentle skin work, because as I told you, the dendrites attached to the skin. We're working on the skin most. And you can also put about 10-15 minutes of hot packs. The heat really helps before you start the manual therapy work. And the very nice skin work about 15-20 minutes after that by your registered physical therapist will really help you to manage the condition of cotting. So cotting work can be done, and it's very effective. Manual therapy can be done. Nerve injuries, as you see in this picture, the second picture there, the long thoracic nerve supplies your serratus anterior muscle, which is on the side right here, the punching muscle we call it. If you do this, you can see that coming out here. That's your serratus anterior muscle. It's supplied by a long thoracic nerve, and look at the approximation of the nerve to your breast, right? It can sometimes get injured during the surgery. So when you have that problem, then you're going to develop something called scapular winging, right? So you see that picture in that lady when she's trying to do that, how is her left shoulder blade just wings out. That because serratus anterior stabilizes the scapula, and when that muscle is weak, you're going to wing out. So this is something a physiotherapist can help you with managing by means of scapular stability exercises, proprioceptive neurofacilitation, PNF exercises, taping, and those kind of approaches we do for this kind of problems if you have. The other one you see is your thoracodorsal nerve. Thoracodorsal nerve supplies your latissimus dorsi. That's a big muscle coming from all the way to your pelvic crest to the back of the shoulder, right? So when that nerve is injured, your extension of your shoulder must be weak, and some truncal imbalances will come because latissimus dorsi really, it's a guy wire muscle for your spine, right? It's on both sides going up like that from the pelvis to your shoulder. So these are some of the nerve injuries and partial changes can happen, and we have to identify at the early stage and start working on those muscles which needs some work. And also physiotherapy is prehab before your breast cancer reconstruction surgeries, whether it can be expanders or implants. We can do some prehab work, and also we can do post-operative rehab as well. It depends on what your procedure is. Like, are you in the expander stage or the implant stage? I didn't put a lot of pictures here because you can see the skin is being stretched so much in the front of the breast, so a lot of things can be done to work on that area. Breast reconstruction surgeries, there are some options there. They can take your latissimus dorsi from the back to put it in the front. So that time what kind of prehab and post-rehab you do is a little different than your flap. Okay, this one is, the second one is your tram flap, which is your transverse rectus abdominis muscle. They take from your abdomen. This is a very wide incision, goes from hip bone to the hip bone, and then they take it, they flip it and put it and make a reconstruction of your breast. And the other one is a dip flap. They don't take the muscle in that one. They just take the fat, blood vessels, and then place it in there. The recovery is very good in your dip flap because there is not much muscles have been taken at all, no muscles at all involved, compared to your tram flap, where is a whole bunch of muscle is being transferred to create that breast reconstruction. So a surgeon will take care of those things and they will advise what you need, and you and your surgeon can decide what is needed, and then we can help you with the prehab and the post-op rehab after your reconstruction surgery, addressing everything, your musculoskeletal system and your lymphatic system, and also any other systems needed for help, and your pelvic floor as well. So most of the times we, after these kind of surgeries, there is 28% chance for the capsular contracture. Capsule is the one that surrounds your joints, especially in the shoulders, the areas. So you can have a lot of stiffness there. So that's when a lot of good manual therapy, myofascial release, and mobility exercises, active and active assisted, and also exercises really helpful to work on that areas very much. So the statistics also always tells us that breast cancer survivors have a very low complaint rate. We have seen it in our clinics too. We don't know the exact reason why. Even they know all the benefits of the exercise and the breast cancer rehab program, but the complaint rate is less. That's one of the reasons why I'm doing this episode, to create more awareness to the people who are suffering or who are in this breast cancer area, to understand the benefits outweighs, right? So just so much benefits of exercises. I know it is really difficult situation, difficult time, but you can definitely, there's help out there. You can get good help from your physiotherapist for your recovery. And it improves your quality of life. It's not only just your muscle strength, your cardiopulmonary fitness, physical functioning. You can go out and do the things you want. Even return to work, driving, return to work in a modified level. We can help you with that, with ergonomic advice, and also with planning your return to work in whatever way you can. And your physio doesn't stop just right away after 6 weeks or 8 weeks. It continues until you kind of feel good. You can do everything by yourself, and also can help you with reducing the compensation strategies under long-term postural changes as well. This is just a slide for a sample exercise program. Credit goes to Physiopedia. Just to give an understanding of the exercises, I just told you about few things. They all can be put in together and formulate a nice exercise pattern with different repetitions, and find your assessment day will find your what's your maximum effort you can do and maximum load you can handle. They can work with 50%, 60%, 75% of the load, depends on which week you are at, and combining the strengthening, the mobility exercises, the breathing exercises, the pelvic floor exercises, everything together, along with addressing your biopsychosocial issues, and we can really help you in the road to recovery. So if you have any questions about your breast cancer rehab, feel free to shoot an email to me at giri@physioshow.ca, or also visit our website physioshow.ca. There are a lot of other episodes for you to learn and get benefit out of it too. If you see this and if you like this and you think this information will be helpful for anybody in your friends and family circle, please share that with them, and so they can be helped. They can improve the knowledge about what they can do for themselves, and also what they can do with the help of a physiotherapist in the community in the recovery from the breast cancer, whether it's conservative management or post-surgical management. Hope this was helpful, and until I see you the next time, bye. Thank you.